Hi friends, I am your friend Dr. Shilpi Goyal, the radiologist. This is part 2 video of early pregnancy failure. So what are the causes? Causes can be chromosomal anomalies, which can be polyploidies, monosomies or trisomies, or luteal phase defect, because of which there is less progesterone and it is not able to supply the conceptus after the implantation process has occurred. So these are two causes of early pregnancy failure, which are grossly responsible for failure of pregnancy. Now we come to the findings which are diagnostic of early pregnancy failure, which are on ultrasound. So first finding is absent cardiac activity by the time crown rump length is more than 7 millimeters. So first thing is either crown rump length is more than 7 millimeter with no heartbeat. Second thing, mean sac diameter of gestation sac is more than 25 mm but fetal pole is not seen. Third finding can be if ultrasound shows a gestation sac without a yolk sac and you do a follow-up ultrasound after 2 weeks, then there is absence of embryo with a heartbeat. This is diagnostic of early pregnancy failure. Alternatively, if there is gestation sac with a yolk sac is seen and you do a follow-up ultrasound, but you do a follow-up after 11 days and there is absence of embryo with a heartbeat after 11 days, then it is also diagnostic of early pregnancy failure. So what are the three findings? Crown rump length more than 7 mm with no heartbeat, mean sac diameter more than 25 mm with no embryo, and third thing is absence of embryo with a heartbeat 2 or more weeks after ultrasound shows a gestation sac with yolks without yolk sac, and 11 days if shows gestation sac with a yolk sac. So coming to few images. Here in this image, the crown rump length is 20 mm, that is more than 7 mm, but there was no cardiac activity. So thus this was diagnostic of early pregnancy failure. Also we can see there is irregular contour of gestation sac, which is again a sign of poor prognosis. We come to the next image. Here we see the mean sac diameter is more than 25 mm, that is 29 mm, but no fetal pole is seen. So again this is diagnostic of early pregnancy failure. Here we see two images. On the left side, on the left image, we see there is a gestation sac and there is a yolk sac. And mean sac diameter is 14 mm. So we do a follow-up ultrasound 13 days later. Then we see an embryo, but no cardiac activity was detected. Hence, this was diagnostic of early pregnancy failure. So this is all about findings diagnostic of early pregnancy failure. In the next segment, we'll talk about findings which are suspicious of early pregnancy failure or the factors which indicate poor prognosis or continuation of pregnancy. Thank you.